Scabies is caused by a mite called Sarcoptes scabii. It penetrates the skin, causing intense itching, especially at night, and is highly contagious. Many people ask themselves, how can I treat scabies effectively? If you are looking for answers to this question, then you have found it. Because today we will explore everything about the treatment, prevention methods, and how to deal with the symptoms of this condition. The first point here is, what is scabies? We commonly call it scabies when the skin is intensely itchy, especially at night. This discomfort occurs because the female mite digs small tunnels in one of the layers of the skin to lay its eggs. In addition to itching, scabies can present small blisters or pustules, which are pus-filled blisters. The most affected areas include the wrists, between the fingers, armpits, abdomen, inner thighs, and genital area. Scabies can affect anyone, regardless of their level of hygiene, but it is more common in crowded places, such as schools, daycare centers, and nursing homes. The stigma that scabies is associated with poor hygiene is a myth. The essential factor is close contact with infected people or contaminated clothing and objects. Now let's go straight to the treatment. What is the first-line treatment? The most recommended treatment for scabies is the use of 5% permethrin. Permethrin is an insecticide that destroys mites and their eggs. Permethrin is active against a wide variety of parasites, such as lice, ticks, fleas, and the mites that cause scabies. For scabies, the product is applied all over the body, from the neck down, covering all areas, and is left to act for 8 to 14 hours. After this time, the patient takes a shower to remove it. In most cases, one application will solve the problem, but in some cases, it may be necessary to reapply after 14 days to ensure that all mites and eggs have been eliminated. Permethrin is generally safe for most people, including children and pregnant women. Side effects are rare, but may include worsening itching, a burning sensation, or rashes or sores on the skin at the application site. These symptoms, when present, tend to be mild and temporary. That is why this medicine and any other should only be used under medical supervision, especially in children, pregnant women, and people who are sensitive to medications. Now let's look at another medicine. Oral ivermectin. Is it an effective option? The answer is yes. Ivermectin is an effective option, especially useful in more severe cases or for patients who prefer oral treatment. The standard dose of ivermectin is 200 d-chool of body weight. When your doctor prescribes the medication, he or she will calculate the correct dose for you. It is a medicine that is usually prescribed to be taken once, with a repeat dose after 14 days. Ivermectin is particularly effective in cases of crusted scabies, a more severe form of the disease, characterized by thick crusts on the skin that contain thousands of mites. Ivermectin can also have some side effects, such as nausea, diarrhea, and abdominal pain. In rare cases, it can cause mental confusion or hepatotoxicity, that is, affect the liver, which highlights the importance of monitoring the patient during treatment. But besides permethrin and ivermectin, are there other treatment options? If permethrin or ivermectin are not available, or if the patient does not respond well to these treatments, there are other options. Benzyl benzoate and crotameton are alternative topical treatments. They can be used by patients who cannot tolerate permethrin or for whom the initial treatment was unsuccessful. Just a note here, I have never seen crotameton available in Brazil. However, since this content is translated into English and Spanish, here is a highlight for you to check the availability of the mentioned remedies in your country. Lindane 1% is also an option, but its use is restricted due to the risk of neurotoxicity, especially in children and pregnant women. For this reason, it is considered a last-line alternative, used only in specific situations. Brazil, for example, has eliminated this medicine from pharmacies, but there are other important things about scabies, besides the medicines. Are you knowing the environmental measures to prevent reinfestation? Treatment of scabies is not limited to the patient taking medicine or applying a lotion or cream. It is essential to adopt environmental measures to avoid reinfestation, that is, catching the mite again and getting scabies once again. Many medical colleagues recommend that close contacts, including family members and people who share the same environment, should be treated simultaneously, even if they do not show symptoms. This is because the mite can survive for up to 72 hours outside the human body. Clothes, bed sheets, and towels used by the person with scabies should be washed and left submerged in water for a few minutes. Hot water also helps, killing the mites in the fabrics more quickly. After washing, to ensure that all the mites have been eliminated, the clothes should be dried at a high temperature, or, after drying in the air, ironed with a hot iron to ensure that none are left. Items that cannot be washed, such as pillows or stuffed animals, should be placed in sealed plastic bags for at least 3 days to ensure that the mites die. And what about those people who have crusty lesions on their skin? Well, let's talk about care for crusty scabies. Crusted scabies, or Norwegian scabies, is a more serious form of the disease and usually affects people with compromised immune systems, such as the elderly or patients with chronic diseases. In these cases, the number of mites on the body is much greater, and the skin can develop very thick crusts. Treatment for crusted scabies requires a combination of topical permethrin and oral ivermectin to control the infestation. How long do symptoms last, and how long do they expect to cure? Even after effective treatment, it is common for the itching to persist for a few weeks. This is because the body is still reacting to the damage caused by the mites and their eggs. However, if the itching continues for more than 4 weeks, or if new bumps appear, it may be necessary to see a doctor again to determine whether there has been a reinfestation or whether a new course of treatment is necessary. Now, another important question. How can scabies be prevented? Preventing scabies involves avoiding direct contact with infected people or objects. Places such as schools and nursing homes, where there are large crowds of people, require special attention. Employees of these places must be alert to signs of scabies and act quickly to prevent the infestation from spreading. It is essential to treat all people living in the same house and strictly follow the guidelines for cleaning clothes and personal objects. This prevents the infestation cycle from continuing and other people in the environment from becoming infected. Scabies can be extremely uncomfortable, but treatment, when done correctly, is effective and eliminates the infestation. Medications such as permethrin and ivermectin are proven solutions, while environmental measures are essential to prevent reinfestation. Therefore, at the first sign of scabies, seek medical advice and start the prescribed treatment quickly. This way, it is possible to control the symptoms and prevent the infestation from spreading. Agreed? Did you like the information? Like it, subscribe to the channel and share the link to this video in your family group and in your children's school group. Many people need to know everything I said here. Do you agree? I also invite you to click on the Become a Member button so you can help the channel grow. By becoming a member of the channel, you will also have access to extra content, in addition to helping the channel grow. Here, Daniel Coriolano, a big hug, and see you next time. This video that is appearing on the screen, just click.